Leo Galland, MD, is a board-certified internist. He's recognized as the world leader in integrative medicine. Educated at Harvard and the NYU School of Medicine, he won the Linus Pauling Award for his trailblazing vision that created a bold new approach toward healing for thousands of doctors. Through his clinical work and writing, he brought the concept of leaky gut into the mainstream, and he created the integrative approach to gut health. Dr. Galland believes in empowering people to overcome their health problems by reversing the root cause. He's the co-author of The Allergy Solution, The Surprising Hidden Truth About Why You Are Sick and How to Get Well, with his son, Jonathan Galland, JD. That book is available now for pre-order on Amazon. Dr. Galland is featured in the New York Times, the Wall Street Journal, Newsweek, Self, Men's Fitness, and he also writes for the Huffington Post. He's also appeared on The Today Show, Good Morning America, PBS, CNN, MSNBC, and Fox. So you can learn much more about gut health and integrative medicine by going to his website, which is drgalland.com. You can also follow him on Facebook and Twitter. We're certainly very lucky to have him on this year's 2016 Gut Summit. Thank you very much, Dr. Galland, for giving us your time to do this interview today.
Well, Donna, it's great to be talking with you today. It's always a pleasure.
Well, I'm excited because this, you probably have been in the field of gut health long before it became popular. I mean, I'm sure you did, because I've known about you for decades, really. I don't want either one of us to sound very, very old for saying that, but it's true. And you were the go-to doctor when people had gut problems, which is a lot of people, 20, 30 years ago. It was you they went to, and you were into parasites and so much more, like thinking out of the box than anybody else at that time. So thank you for doing that. And then this world of the gut, I really want to get into the book and allergies, and I want to tell people right off the bat that if they think they already know about allergies and they're treating them, you don't know about what's in this book and what we're going to go into in the interview today. So stay tuned, because we're taking you on a journey into the gut microbiome to really understand how fascinating and complex it is. But I know that every single week there's something happening in the world of the gut. Like, people are coming out with new information about what's happening down there. I thought it would be good for us to just kind of start right there and give people an idea of the microbiome, this community that's inside of us. And, I just want people to have kind of more of an awareness of this world, because I don't think people really take the time to stop and think about it. They think, well, there's little bugs in there in my gut and they're doing all this stuff, but I don't think anybody knows the microbiome as well as you do. So could we start there and just kind of talk about the microbiome, and anything that pops into your mind, just go there.
Sure. I'm happy to do that, and especially to highlight the very important relationship between the microbiome in the gut, allergies, and inflammation, and the way each of these feed into each other and contribute to the problem that has been called leaky gut, and how that becomes part of the vicious cycle. So, first of all, the microbiome is a term that is used to describe the 100 trillion bacteria that normally live in your gastrointestinal tract, from your mouth down to the end. There are anywhere between 3 and 10 times as many bacteria living in your gut as there are human cells in your body. And there's a tremendous diversity of these bacteria. In the allergy solution, I compare it to a rainforest because of the diversity of life that is there. And, we think of bacteria as, well, they're all kind of the same. They're just germs. But in fact, if you take two of the main types of bacteria, lactobacillus and bifidobacteria, that are used as probiotics, they are as different from one another as a human being is from a chicken, for example.
Wow, that's a big difference.
Yeah, they are in, actually, no, they're further away than a human being and a chicken, more like a human being and a fish. No, even further than that. They are in different phyla, which is the largest category of classification for in biology. They go back in terms of evolution. They are so far apart that it's hard for us to imagine because we just think of them as just being germs. And they have some similarities, but they have tremendous differences. So there is this huge diversity of microbes living in our bodies. And that diversity is very important for health, which makes our bodies like rainforests, because we know that it's the biodiversity of a rainforest that is a sign of the health of the forest. The same is true in our guts. Now, allergies and inflammation actually is one of the factors that can really interfere with the diversity of these microbes. And it pretty much happens like this. And there's a lot of stuff that comes out. This discovery about the microbiome and that discovery, virtually every week there's something new that comes out, and it's pretty interesting stuff. But almost all of this research, especially when it looks at the relationship between microbes and health, ignores the fact that inflammation in your body changes the microbiome. See, when you have a state of inflammation, which would include allergic reactions, you get a release of something called nitric oxide. And it's a normal mediator in your body. And when nitric oxide is released, and it does a lot of good things, the residue that it leaves are called nitrates. And when nitrates build up in tissues because of inflammation, they encourage the growth of specific bacteria and discourage the growth of other bacteria. So having high nitrate levels due to inflammation changes the microbes in your gut. And in fact, it restricts the diversity of microbes, and it encourages the growth of microbes that provoke further inflammation, which is why there's a vicious cycle. And it makes totally perfect sense from the perspective of the microbe. You're a microbe that likes a high nitrate environment to live in. You like inflammation. Well, you're going to work to increase the amount of inflammation in the tissues where you live. I mean, any organism would do that. It just makes sense. So once you start getting inflammation, you get these microbes that thrive on inflammation, and they create more inflammation. And the effect is a vicious cycle in which there are disturbances in the microbiome, there's a loss of diversity, and it keeps perpetuating itself. And loss of diversity of gut microbes has been shown to be one factor in the burgeoning epidemic of allergies that is sweeping the world. I mean, there are 1 billion people in the world who have allergies today.
Would you explain the difference between an allergy, a true allergy, and, like a peanut allergy where you could die from eating peanuts, or just being really, really sensitive and reacting to foods? I mean, isn't it a spectrum, would you say, like from really serious reaction to? Could you kind of explain that?
Absolutely. And that's important to understand. And I deal with it in the allergy solution as well. There are many types of sensitivities and hypersensitivities. They involve exposure to something which is a trigger, which then produces symptoms or effects. Now, in the case of allergy, allergic reactions are self-amplifying chain reactions. And the amplification of the response to the trigger is produced by the immune system. So the result is that a minuscule amount of a trigger can produce a catastrophic or devastating effect. Now, peanut allergy is one of the most serious examples, but it's only one type of allergic reaction. But trace amounts of peanuts in a person who's allergic can produce a fatal reaction because of this immense amplification that occurs. It's like a snowball effect caused by the immune system. Now, if the immune system is not involved in amplifying the reaction, it's not an allergic reaction. It could be very serious, but it's a different kind of reaction. peanut allergy involves something called type 1 allergy, but there are many types of allergic reactions, many types of immune amplification reactions, and they're all important, and they can produce a wide variety of symptoms, many of which you don't even think of as being allergic, from headaches to depression to fatigue to joint and muscle pain to asthma, eczema, hives, and other classic allergic reactions.
Can I just ask you a question right there, though? Depression. I would think it's such a problem today, and people are going to the doctor for drugs and everything. Would that be on that list too?
Oh yeah, depression can be a symptom of allergic reactions, and I've seen it with both mold and with food.
Mm.
And I'm not saying that everybody who's depressed has allergies,
Hmm.
but allergies can be a cause of depression. And when it is atypical or doesn't seem to be due to something that is readily obvious, when it doesn't respond well to medication, especially if there are mood swings and a kind of bipolar depression, you really got to look at environmental and food allergies.
That's interesting.
I've seen that many times. What I wanted to say is, in terms of the GI tract, allergies can affect the GI tract in numerous ways. Food allergies can cause heartburn. There's a condition called eosinophilic esophagitis, which is basically a food allergy disorder, and it's been increasing dramatically over the past 30 years since it was first described. Allergies can cause abdominal pain, diarrhea, constipation, gas, bloating. Now, you can have other types of food reactions that are not allergic that can cause those symptoms also. But allergy is a well-documented cause of all of those GI problems and is an important cause of the phenomenon that's known as leaky gut. And I don't know if you want to talk about leaky gut right now, but it's something a lot of people are concerned about.
Well, we have two types of people listening. We have some people that I'm sure are brand new to this, but we have tens of thousands of practitioners listening. So I think that it's good to always cover the basics and then even throw in some really juicy stuff for the practitioners.
Okay, well, I mean, everybody needs to know about the phenomenon of leaky gut. And in order to understand it, the first thing you have to think about your gut in a new way, in a different way. It's not just there to absorb nutrients from food and expel waste. That is one of the functions, and it's an essential function. But the gut also is a barrier. Now, inside your gut is the most toxic environment you will ever be exposed to, produced by these 100 trillion bacteria and their byproducts, by food and components of food that you ingest, by mucus that you swallow, by bacteria that you swallow with the mucus. Your body needs to be protected against the toxicity of this environment. And when the barrier is broken in any way, when there are too many spaces and holes in it, when it doesn't function effectively, then you have a phenomenon which technically is called increased intestinal permeability, something I've been writing about for 30 years, but in the popular lingo is called leaky gut. What's really fascinating to me is that back in the 1980s and 90s, when I was lecturing and writing about leaky gut, I would have patients that would go to see gastroenterologists, and they would kind of sneer and say, there's no such thing as a leaky gut. That's ridiculous. The past 10 years, the data on increased intestinal permeability and leaky gut as a factor in a wide range of disorders, metabolic disorders, weight problems, cardiovascular disease, autoimmune diseases, inflammatory diseases, has just been overwhelming. So you will see the term leaky gut in the most prestigious medical journals today. So, and that's a phenomenon that I've seen happen over and over again. There are concepts that practitioners of integrative medicine are talking about that are pretty much routinely ignored by the conventional medical establishment. And then the research catches up with what we're doing and looking at in clinical practice. That's been true for leaky gut, for the importance of gut microbes, for the importance of omega-3 fats, for nutrition in general. The research, I mean, we're seeing effects that are real, that make a difference to people's health and their lives. And eventually the research catches up and the conventional medical community takes notice of it and then, of course, tries to own it.
Right along with that, people also have thought, or experts thought, that the blood brain barrier was also, we were safe from anything getting into the brain. But if the gut barrier opens up, does the brain barrier open up at the same time?
Well, it may or may not. A lot of the factors that impact on the gut barrier will also impact on the blood-brain barrier. Plus, there are toxins that are in the gut that, once they're absorbed, may readily cross the blood-brain barrier. Some of these are toxins from foods. Some of these are toxins produced by intestinal microbes themselves. Last December, I published a paper in the Journal of Nutritional Foods, the Journal of Medicinal Foods, called The Gut Microbiome in the Brain. And I looked at all these relationships between gut microbes and how their metabolic activity and their effect on the immune system impacts on the brain. But to get back to allergies, an allergic reaction to a food can cause a leaky gut. And the chemicals that are released by the allergic reaction cause the gut to become leaky. And then all the different conditions that can be produced by a leaky gut may occur. So allergic reactions to foods may cause symptoms and conditions that are due to the allergy itself, or they may cause symptoms and conditions that are due to the leaky gut produced by the food allergy. One example of this is migraine headaches. In migraine headaches, there has been a theory that there are toxic substances that produce the migraines. But a lot of the data on migraines have shown that the toxins are not basically in the foods. The toxins are basically in your gut. And the role of food and the reaction of the food to the food is an allergic reaction. It's an immune reaction to the food that creates the leaky gut that allows the toxins to be absorbed into the body. So being able to identify the allergic reactions and the foods that trigger it plays a critical role in healing the leaky gut and all these different manifestations of leaky gut. Leaky gut has been described in people with chronic fatigue syndrome, fibromyalgia, depression, and it definitely can create or contribute to the symptoms of those disorders. But the question is, what is causing the leaky gut to begin with? And often that's an allergy or a disturbance in gut microbes, which sometimes is the result of the allergy. So there's a tangled web of causation here in which allergies play a very important role, which is the reason I decided to focus on allergy as the key to understanding so many different kinds of problems.
I think the book is deeper, really, than the title. It's so difficult to title a book and really explain to people that what's inside is so much, much more than just that. But let's take gluten, because, everybody's concerned about that today. And some people really do have genes that make them truly allergic to it. And then some people are just reacting. What really surprised me, I'm sure lots of people are thinking this, is I didn't realize it. Would it be the wheat that's the problem, or the fact that the bugs in there are reacting to the wheat?
Well, there is definitely an impact of bacteria in the gut on gluten sensitivity. Let me just go back one or two steps to make this really clear. So, gluten is a set of proteins that are found in wheat in particular, but also in barley and in rye. And there's some gluten-like proteins in oats. Gluten can produce symptoms, either GI symptoms or neurologic symptoms, when the gluten is broken down into these fractions called gliadin peptides that provoke in susceptible people an inflammatory immune mediated disorder, similar to an allergy, although gluten sensitivity is not usually categorized as a classic allergic reaction. When this happens, the gut becomes leaky. The inflammation produced by exposure to gluten in sensitive people creates a leaky gut, and this condition is called celiac disease. And it can produce symptoms as varied as fatigue, balance disturbances and neurologic problems, diarrhea, weight loss, and muscle and joint pain. Now, about 1 or 2% of the population in the United States and in European countries has genes that predispose them to developing celiac disease, that is, this immunologic gluten sensitivity. This condition is a very complicated condition, but what's really surprising about it is, although this is a genetic disorder, and it's a genetic disorder that we've known how to make a diagnosis of for several decades, the frequency of celiac disease has been increasing pretty dramatically over the past 30 years. So how does it happen that a genetic disorder increases in frequency to a dramatic extent in a short period of time? And there are theories about it, some of which are, well, wheat is changing, so the nature of the gluten that we're exposed to is changing. I'm not sure that that's the cause. What we do know is that gut flora impact on how sensitive a person is to gluten. And there are two particular types of organisms in the gut that will do that. The first is bifidobacteria. Bifidobacteria are probiotic organisms. They're considered good bacteria. They have an anti-inflammatory effect in the GI tract. They also secrete or produce enzymes that break down the gliadin peptides so that they're less likely to provoke allergic inflammatory reactions in people who are susceptible to celiac disease. An absence of bifidobacteria is one factor in the increasing incidence of celiac disease in the world. And this is probably the result of, number one, antibiotics. Number two, the use of pesticides and herbicides in food, because these pesticides and herbicides are fundamentally antibiotics. That is, they're killing living organisms. That's why they're being used. And number three, changes in diet, because there are certain specific kinds of foods that bifidobacteria thrive on, prebiotic fibers and other kinds of prebiotic foods. And these are being depleted from the Western diet. So these changes are depleting bifidobacteria and are increasing the incidence of celiac disease. Lack of bifidobacteria has also been identified in autistic children as well. And autistic children are often food sensitive and have leaky guts. So this decline in bifidobacteria is related to the increase in celiac disease and the increase in autistic spectrum disorders that is paralleling the increase in celiac disease and is at a galloping rate.
Now, bifidobacteria is the prominent bacteria in the newborns, the baby's gut when we first enter the world. And I think a lot of people feel that it just diminishes as we get older and then it's just not in there very much. Are you saying that the bifido should be present throughout our entire life? And if we were eating a certain way, they would always be there. They're not just for babies.
Right. Bifidobacteria are not just for babies. The galacto-oligosaccharides that are found in breast milk are prebiotic foods. They're prebiotic sugars in breast milk. And a probiotic is a good beneficial bacteria. Probiotics are beneficial bacteria that are used as supplements to build up healthy bacteria in the gut. Prebiotics are foods that encourage the growth of probiotic bacteria. So breast milk contains sugars that encourage the growth of bifidobacteria. And many of the immunologic benefits of breastfeeding are due to the impact of the sugars in breast milk on gut bacteria. These are not ordinary sugars. This is not like having table sugar or high fructose corn syrup. Those things have really negative effects on gut bacteria. These are specialized natural sugars that are produced in the breast for the specific purpose of nourishing the infant and nourishing the bacteria in the gut of the infant.
It's interesting that it's definitely the predominant bacteria at the beginning of life.
Yeah. Yes.
It always has said to me that it must be a very important bacteria because it's the first one that shows up.
It is. Bifidobacteria are vitally important for infants. For adults, they're important also because they, for one thing, they make gliadin peptides less toxic because they have an anti-inflammatory effect, because they help to prevent leakiness in the gut. So the maintenance of a healthy population of bifidobacteria throughout life is important, and it's important for dealing with allergies. But lactobacilli is another group of beneficial bacteria. A lot of people think of lactobacilli as acidophilus, but that's just one species in the genus Lactobacillus. There are many species. There are many strains within each species, and these have beneficial effects on immune function. In fact, in the allergy solution, I reviewed all of the studies that have been done on the use of probiotics for treating nasal allergies. Just, allergic rhinitis, the commonest form of allergic illness in the developed world. Certainly in the U.S., there are 60 million people with allergic rhinitis in the U.S., and I want to say a little story about that also in terms of how it impacts on the brain. But probiotics improve leaky gut and they improve allergic rhinitis at the same time. They have immunologic effects on the body. In terms of reversing allergic rhinitis, lactobacilli seem to have an even more potent role than bifidobacteria because of the way that they directly impact on the immune system. And the effect takes about 3 weeks to 8 weeks to occur, but it has been tested for all sorts of pollen allergies, dust mite allergies, dust allergies. Most people don't even know about this. In fact, I was quite surprised at the large number of studies that have been done. Most of them, of course, not in the U.S., most of them in Europe, some in Asia.
What's sad is that those studies get done, they get reported in journals, and that's as far as they go. They don't get out into the world to become of use to us, which is I've always thought was just really tragic. But as far as the lactobacillus and the sinus, having the right ones in you to improve sinus infections, any particular lactobacillus, like Lactobacillus plantarum, or just a variety of them?
There are studies indicating that Lactobacillus plantarum, which is found in plants. It's found in sauerkraut. Its name comes from the fact that it's a plant-derived lactobacillus, not a milk-derived lactobacillus. L. plantarum has very strong immune-stimulating effects. and has been shown, for example, giving it to people who are undergoing abdominal surgery, they have a decreased rate of wound infections with the L. plantarum. The specific species that has been the most tested in allergic rhinitis is Lactobacillus paracasei, which is a milk-derived lactobacillus species. And I review, actually, in the allergy solution, I go through all of the studies and the specific species and strains that were used because it matters. But in general, I would say that Lactobacillus paracasei is the specific species of probiotic that has the strongest effect measured yet in allergic rhinitis, nasal allergies.
Well, I hope people heard what you said because that's so important. And I think what you're also really pointing to is that there's lots and lots of different types of bacteria in their strains, species, and so on, but they have a function. It's the first thing is I think we found them, hey, they're there and they're doing important things, but nobody really knew exactly what they were doing. But now that's a big area of research, right? Is they're actually looking at the function of specific bacteria. How do they link a bacteria to a condition?
Well, there are several ways that this research is done. The way it's been done over the past decade, in which there's been this explosion of research findings, started out just looking at what bacteria are present and how to, if you're looking at the gut or the nasal secretions or the lung secretions of somebody with a condition, how does that compare with a healthy population? And I would say the most significant finding is that it has to do with this area of diversity. When there's inflammation, there is a loss of diversity and there is an overgrowth of organisms that provoke more inflammation, creating this vicious cycle. And in health, there's a great deal of diversity, and that diversity prevents the inflammation. Now, the next level was to try and look at the question, what do these bacteria do? What is it about good bacteria that makes them good? And there are a few things. First of all, these bacteria talk to each other, so that a beneficial bacterium does more than just take root and do its own thing. It actually influences the whole community of bacteria that are present in a given environment. It becomes a leader, basically.
Yeah, would you tell people about your Alexander theory? I think that's fascinating. Great story.
Okay. Well, yeah. Well, this came to me as I was thinking about the different ways that these bacteria may or may not be important. And so there are specific bacteria which have remarkable effects on the immune system and in organizing all of the other bacteria that are present. And then there are bacteria that have in whom it doesn't matter. So in order to really understand the Alexander effect, you need to first understand what I would call the assembly line effect. They studied the bacteria growing in the guts of healthy infants, and they would just collect their stool every month for 2 years. And what they found was that there was a constant change in the first 2 years of life in the bacteria that were growing there, which are a reflection of the child growing and the diet changing and the introduction of new foods. Once you're not just having breast milk and you start eating foods, there are constant changes in the bugs that are growing there till you're about 2 or 3 years of age when you develop a stable bacterial population. It didn't matter what bugs were there when the infants were healthy because they did the same things. It was kind of like an assembly line. The night shift leaves, the day shift comes on, they're making the same product. So for a lot of the bacteria, especially during normal development, doesn't exactly matter which healthy bacteria are there. They're all doing the same things. Then you get into a situation where there are specific bacteria that dramatically alter everything that's going on. And this has been discovered in people who suffered from being obese. And this is the case in allergies. And these studies have been done mostly in mice, but also in humans. And so I thought about Alexander the Great. 2,300 years ago, Alexander the Great conquered a good part of the world that was known to the Greeks, from Italy to Afghanistan. Alexander's armies overrun it. Well, clearly Alexander didn't do this by himself. It was the Macedonian armies that did. But almost all historians agree that the armies did it because of the leadership of Alexander. But Alexander needed that specific army. This was an army that had been trained by his father Philip, and they were totally loyal to him and would follow him anywhere. So there are organisms that are like Alexander. They are the leaders. They will get the rest of the microbiome to do what needs to be done. And I call these Alexander microbes. And when it comes to allergies, it's possible that there are a lot of species of lactobacillus that can do it, but there was this fascinating study that was done in San Francisco at UCSF, which involved dogs. Okay, so they took dust from two different homes. One was a home that had a dog, and the other was a home that had no pets. And they fed this dust to mice, and then they looked at what was going on in the immune systems of the mice and in the gut microbes of the mice. And what they found was that if they fed the dust from the home with a dog to the mice, those mice became resistant to developing allergies. Whereas if they fed dust from the homes without any pets, it was easy to get those mice sensitized to things like egg white proteins by injecting it into their skin.
Well, what if the dogs? Why? Why is people think they're allergic to their dogs sometimes, or people buy dogs they're not allergic to.
Right. Well, right. So in order for dogs to prevent allergies, you need to be exposed in the first 6 months of your life. And the other thing about the dogs, because they've been looking at the effects of dogs, having a dog on the microbes and families, it probably needs to be an outdoor dog, because dogs that just stay indoors don't have the same impact as dogs that are kind of roaming outdoors. So in that sense, maybe the dog is a little bit like a farm animal or some outdoor animal that comes into the home. But here's what they found, and this is where it gets the specific microbe. When they looked at the gut microbes of the mice fed the dog dust versus the regular dust, there was a great deal more diversity of the gut microbes in the mice who had been fed the dog home dust. And there was one particular organism called Lactobacillus johnsoni that was especially strikingly present. So they isolated it, and they fed Lactobacillus johnsoni to mice who had been fed dust from homes that didn't have any pets. And the Lactobacillus johnsoni had the same effect as feeding dust from a home that had a dog. So that was the specific organism in that study that was like Alexander, that was able to increase the diversity of all the beneficial microbes in the gut and prevent allergic reactions. There's been a similar study done with obesity and weight gain as well, and a totally different organism is responsible for that effect.
Do you want to tell us that organism's name? I have an idea. It starts with a C.
Yeah, it's this organism called Christensenella that nobody heard about until a few years ago. And they were doing all these studies trying to figure out ways to, it's very clear that the microbes living in your gut impact on your weight. It's also very clear that there's a genetic influence on your weight, and that there are genetic influences on what microbes are able to comfortably grow in your gut. And they've done all these studies trying to figure out which microbe it was, and even a probiotic that consisted of 35 different microbes isolated from people who were lean, that wasn't enough to work. You needed the whole microbiome until they discovered Christensenella. and which isn't yet available as a probiotic, but when it is, if there's a way to stabilize it, it may really revolutionize the weight situation. When they discovered Christianella, they were actually, well, it had been discovered, they were actually able to demonstrate, at least in mice, that Christianella had the same effect on weight gain as the whole microbiome of an obese or a lean person or an obese or a lean mouse. So that's another Alexander organism that can increase the diversity of gut bacteria in a healthy way. Now, there is another influence on weight that is underappreciated that relates to allergy and does relate to the whole leaky gut phenomenon. Food allergies can interfere with weight loss. And if you're eating a food that you're allergic to, or if you're exposed, when you're exposed to something in the air, like a mold, for example, even though you're breathing it in, you are swallowing it as well. It's getting down into your gut. And when you're exposed to a substance to which you're allergic and it gets down into your gut and it creates leakiness in the gut, that can create a state of inflammation in your body that interferes with weight loss. And the mechanisms are probably, there's several mechanisms by which it does that. But if you have difficulty losing weight, then you really need to figure out whether you have allergies that are the culprit that makes it impossible for you to lose weight.
Now, getting back to those two Alexanders, the Christianella, and the Johnsoni, when do they get into our gut? Like I know that the Oxalobacter formigenes, which eats oxalates, that guy, enters the gut about the time we start crawling. So, how do you get them in, these good guys, the Alexanders that you want inside of you? And what if you have two Alexanders in there? How does everybody, do they start to go to war? Is it like sort of the Democrat Republican Party where they're like, they don't get along very well with each other and they have their own teams? And
the research hasn't gotten to that point to look at how does Christianella interact with lactobacilli. And it may be different for different species. The individuality of the person has a significant impact on that, because Christianella, lean people naturally grow Christianella in their guts. That was what studies using twins indicated.
Well, but then that's a little like, what if you're already overweight and what do you do now?
If you're already overweight, changing the leaky gut and gut microbes can really impact on your weight. But you probably have to start by making sure that you're not consuming foods that produce gut inflammation or a leaky gut. And where the research is with this is that there's certain kinds of diets that are highly inflammatory, like a typical Western diet. There are certain bacteria and bugs whose growth is encouraged by these diets that are inflammatory. And when you get this kind of inflammation in the gut, it creates leakiness. It allows toxins from the GI tract to be absorbed. This condition has been called metabolic endotoxemia, and it has been strongly associated with weight gain, diabetes, heart disease, the so-called metabolic syndrome.
And the endotoxemia, meaning the bacteria are producing these toxins, the bad guys.
Right. The bacteria are producing toxins that are absorbed into your body and that have negative metabolic effects. But it's also a vicious cycle, because the inflammation that results from that makes the gut leakier. So with these leaky gut disorders, which are all vicious cycles, whether they produce joint pain or muscle pain or depression or headaches or inflammatory bowel disease, or the metabolic syndrome and diabetes and weight gain, whenever that happens, you have to find some way to break the vicious cycle, to stop it. And one of the most important aspects of that is eliminating foods to which you're allergic and that provoke a vicious cycle. And there are numerous techniques and ways to accomplish that. I described the technique that's worked best in among my patients in the allergy solution, but there are many ways of doing that. And I strongly encourage people who are having those kinds of problems to start by trying to determine whether there are foods that they need to eliminate in order to heal the leaky gut.
If someone doesn't have a chance to come see you, or they don't have the money, let's say, to pay for the right tests, could they just start with an elimination diet and go off the basics like gluten, sugar, dairy, soy, whatever?
Donna, elimination diets are a great place to start dealing with the most common allergens.
Which foods would you recommend?
It's wheat and corn and soy and dairy.
Eggs? Would you say eggs?
Well, there's no food that has not produced an allergic reaction in somebody. I mean, I once saw a woman who had an allergic reaction to broccoli, and the reaction that it produced actually was a vaginal discharge. I mean, she thought she had a yeast infection. She had an allergic vaginal discharge, which was caused by broccoli. Pretty rare. So there isn't anything that can't be a problem. But the staple foods of the modern Western diet are a large part of that problem. And that's a place to start. And of course, a lot of these foods are genetically modified, like soy, for example. And so here's the thing about genetically modified foods that I think is really important. The reason that these foods are genetically modified is to allow them to grow in the presence of herbicides like glyphosate or Roundup. Now, glyphosate has antibiotic effects, and when chickens were exposed to glyphosate, it really screwed up their gut bacteria. So if you're eating foods that are genetically modified, these are foods that have been grown in soil that has been sprayed with glyphosate, and their leaves and their stems have been sprayed with glyphosate to kill weeds. But the glyphosate is going to be in the plant. This plant is genetically modified to be resistant to it. So you are going to be consuming glyphosate. And the effect of consuming the glyphosate is that it potentially changes the bacteria in your gut. So as part of an attempt to eliminate allergies, I think it's really important to stick with organic foods and stay away from GMO foods.
That's a great visual, that the plant is actually, it is resistant and it is holding on to it, and then it gets in your body and affects you. Now, just to get back to the Alexander effect, there's got to be bad Alexanders that get in the gut and everybody follows him. Do you find that's true? I mean, what happens? And then if you do have a bad leader, what do you do in your practice to get rid of him?
Well, yeah, if there are organisms that are really screwing up the gut, and I've seen this with parasites and yeast in particular, you need to get rid of them, and sometimes that's the first step that you have to take. In my practice, often we'll use prescription drugs. There are herbs that can work very well to kill bad organisms, and sometimes a combination of the antimicrobial herbs and the probiotics together work the best.
Is it safe to take them together, say oil of oregano and cat's claw?
Yeah, you can.
And what are some of your favorite botanicals?
Okay, well, my favorite botanical is berberine, which comes from a few sources: Oregon grape and Chinese threadroot, or two of them. Berberine has numerous beneficial effects in the GI tract and also some beneficial metabolic effects. So I use a lot of berberine in my practice. I sometimes will combine it with other products. Grapefruit seed extract is a really interesting product that has gotten some misdirected publicity by people who don't understand the composition of grapefruit seed extract. I first learned about it about 30 years ago and started using it. And I've really found very positive effects in the elimination of parasites and the elimination of and the reduction of candida with grapefruit seed extract with almost no side effects. That's one that and the combination of berberine and grapefruit seed extract has worked very well. Artemisia is another herbal derivative that's useful for dealing with parasites and certain kinds of bacteria. Olive leaf extract. I like oregano, but it's pretty strong. It can be fairly irritating. So you have to have a relatively strong gut to be able to handle oregano.
I recently looked up berberine for somebody that I'm working with she's pregnant, and found, unfortunately, that it is not good for women during pregnancy, but it's one of my favorite too because it has so many functions. Like, it is wonderful for inflammation too.
Yeah, it is. It's anti-inflammatory. If in pregnancy, there are really very few herbal products that I will use with any pregnant woman. And there are certain drugs that are not absorbed from the GI tract. So if you're in a pinch, sometimes it's better to go with those.
And speaking of pregnancy, I've worked with autistic children as well for years, and they definitely come into the world with a leaky gut. Can you say something about in the womb? Like, many of us might have come into the world with a leaky gut.
Yeah, there is definitely an impact of the mother's gut and its leakiness and the microbes in the gut and allergic reactions that the mother may be experiencing on the developing infant in the womb. And just before I get into the specific studies done in autism, the diet that a woman follows during pregnancy may impact on the likelihood that her child is allergic, if there's a strong family history of allergy. So there have been attempts, and also the diet that a woman follows when she's nursing. Now, there is a model of autism that was developed in mice that is called the maternal inflammation model of autism. And if you induce inflammation in the pregnant mouse, you can actually you can create autistic behaviors in the offspring. And you can totally prevent that by controlling the gut bacteria of the mouse. Now, whether the same change would apply to humans isn't clear because, mice and humans are really very different in terms of their natural diets and the microbes that grow in their guts. So you have to be very careful in drawing specific conclusions for a human from a mouse study. But the principle that's established there is that the gut microbes of humans have a significant impact on, or of mothers, have an impact on the neurologic development of the infant. And some recent research has suggested that the processes that create autism actually begin in the womb. They may not manifest till the child is a year and a half or 2 years old in an obvious way, but they appear to start in the womb. And there are environmental exposures. There are effects of gut microbes on this. So definitely understanding how allergic a person is and what they're allergic to and what they need to control in their environment, how to minimize the extent and the impact of allergic reactions, healing a leaky gut before pregnancy, which is something that I try to do with all of my patients who are of childbearing age. Those are all important processes, I think, for having a successful outcome to the pregnancy.
And then it seems too, like when someone has SIBO, you hear a lot of experts in that field talking about treating the SIBO, but they don't talk about healing the leaky gut or establishing the inner ecosystem after they've had an antibiotic or whatever they've used, botanicals or whatever combination, whatever they've used to get rid of the problem, the pathogen, I guess, is causing the problem. But That is really an important part too. Would you guide other physicians in saying that? Because we have lots of healthcare practitioners that listening that it is treating the bad guy, but it's healing the leaky gut and getting that inner ecosystem into place afterwards.
Sure. And, I mean, almost everybody who has SIBO, which is an overgrowth of bacteria in the small intestine, almost everyone who has that, if you just, all you do is treat them, it's going to come back at some point. I mean, so, and you're going to wind up treating them and treating them and treating them over and over again. So you need to figure out what is it that produced this bacterial overgrowth so that you can prevent it from coming back. And so there are several factors. One is a lack of stomach acid. So that's something that attention needs to be paid to. The second is impaired motility in the GI tract that produces a kind of stagnation that allows the overgrowth to occur. And the third is a dysbiosis, an imbalance of the gut bacteria, which often is produced by antibiotics to begin with, that then allows these more aggressive organisms to overgrow and to move up from the large intestine into the small intestine. So the use of hydrochloric acid supplements, the use of probiotics of a variety of types, and making sure that there's good motility in the gut through a diet that has adequate fiber and that is rich in flavonoids. And flavonoids are really an important dietary factor in assuring gut health and in establishing a healthy gut microbiome. And it's one of the factors that I deal with at length in the allergy solution. Flavonoids are substances that are naturally found in fruits and vegetables. They're often brightly colored in the beautiful colors of blueberries and strawberries, and are due to the flavonoids that are present. And they have anti-inflammatory effects and numerous other effects, and they modify the way that microbes grow. And they impact on the way your immune system develops and the way that bacteria in the gut will affect you. The flavonoid story that I wanted to tell is this amazing discovery about the causes of chronic sinusitis, gut bacteria, food allergies, staph, and disinfectants that are used. And that's one of the themes that I discovered to be really important in terms of the allergy epidemic that is sweeping the world is indoor air pollution, the chemicals that we use. There's a new chemical that is isolated or discovered every 2.6 seconds somewhere in the world. There are hundreds of thousands of chemicals that make their way into consumer products that you use at home. And there is this over-reliance for cleaning on the use of chemicals that kill bacteria. Now, there's this theory of the origin of allergies called the hygiene hypothesis, which basically says that the reason we have allergies and autoimmune disorders is because we're not exposed to enough germs. I mean, I'm sure you've heard that. That actually is, I think, a very misguided theory. It's not that we don't have enough germs. We got loads of germs. It's the type of germs that we're exposed to and the steps that are taken to eliminate germs. So it's all of these chemical disinfectants, for example. So there is a substance called triclosan, which is a chemical disinfectant, and it's very widely used. It's in all sorts of personal care products. It's even in clothing. Now, triclosan is absorbed through your skin into your body, and we are walking around with triclosan in our bodies. Triclosan is found in the secretions in our nose at low levels. Triclosan increases the attachment and the growth of staph bacteria. Staph is a type of inflammatory toxic bacteria. It increases the attachment of staph bacteria to our cells. Now, staph can produce chemical substances, proteins called superantigens that are actually very toxic. And the staph superantigens that are produced in your nose travel, you swallow them with the mucus, and they travel down into your gut where they produce a leaky gut and make you become allergic or enable you to become allergic to food that you're eating. People who develop chronic sinusitis frequently have an overgrowth of these staph bacteria in their nose. They frequently have food allergies that are part of the vicious cycle of the chronic sinusitis. In fact, studies done in Europe showed that food allergies are twice as common as inhalant allergies among people with chronic sinusitis.
Because is the mucus dripping down the throat? Is this into the gut, you think?
I think it's because of the role of staph bacteria that are overgrowing in the sinuses in producing superantigens that create food allergies that then contribute to the leaky gut, which increase inflammation. And it's possible that a lot of this starts with exposure to triclosan, which, people are using these triclosan-containing products often without even knowing what they are, with the idea that they're creating a cleaner environment. Actually, they're creating a dirtier environment or a less healthy environment. And they're not only changing the environments in their homes, they're changing the internal environments in their bodies with the use of a disinfectant like triclosan.
If they merely just quit, avoided the triclosan, would they actually see a change, or would they have to treat the staph then?
Yeah, I think you've got to start. What you need to do is identify what foods you've become allergic to because of this process. Stay away from disinfectants like triclosan. Use organic foods. Use natural cleaning products. Start using probiotics, including nasal probiotics, which is a technique that can really be helpful in reversing chronic sinusitis and chronic rhinitis.
Are there special ones to buy? Because I've actually taken the juice of fermented vegetables and had people use them as droppers in their nose, and that actually seems to be rather effective.
Right, it will be effective. And of course, the fermented vegetable juice will have Lactobacillus plantarum in it.
We put extra plantarum in ours. We have a starter that we added the way I've taught people to make it, so it's very rich in plantarum.
Right, and that's a powerful immune stimulator, and it stimulates the immune system in a direction that shifts it away from allergic reactivity.
So plantarum could be an Alexander leader.
Yes, I'm sure plantarum is an Alexander organism.
Great.
One of my favorites.
Yeah, me too. It's antiviral, I know that. It's an oxalate eater. It degrades histamine. It doesn't usually get gobbled, when people use antibiotics, very resistant to many of the antibiotics out there. I've done a lot of research on plantarum because I've got this starter and I have people put it in the, we recently had our vegetables tested without the starter and without the starter. The count was 160 CFUs. Yeah, that's right, 160 CFUs per gram. If you put the starter in, you got 570 CFUs of plantarum, of bacteria. Because strangely enough, the diversity is even greater. And now I think I understand why. Because if plantarum is one of the Alexander leaders, then he's organizing the others to, rear up and multiply and do the things they do when they're fermenting. So that's really fascinating.
Right. At present, I think that the way you can recognize an Alexander organism is not only does it grow and do there seem to be positive effects, but the microbial diversity increases. So it's working as a true organizer and leader of the microbiome. Whereas with the bad Alexanders, diversity goes down.
That's interesting. Well, this has been an absolutely priceless interview. I'm sure people would prefer for me to go on or do part 2 and ask you more and more questions, but obviously they've got to read the book. And going back to what I said in the very beginning, this is not your typical book on allergies, clearly.
Yeah, no, it's not a typical book on allergies. What my son Jonathan and I did was to look at the allergy epidemic in the world and try to understand what are the factors that are creating this epidemic, and then what can you as an individual do to correct those factors. And that is going to impact not only on your own risk of allergies and your own symptoms, it's going to impact on the people that you live with, because your microbiome, your inner ecology impacts on the ecology of the space in which you live. Your family will be helped by this, and there will be an impact on the planet as a whole. So you start using all these unnecessary antiseptics, if you start taking steps to reverse the kinds of outdoor air pollution that are not only damaging our lungs, but actually making plants more allergenic. I mean, we could go on for another hour about that. It's an area outside the gut. But everything that we do that negatively impacts on us is also impacting on the organisms in the world around us in a way that reinforces the negative effects on us. We can change this.
Do you cover that in the book about allergenic plants? That's the first time I've ever heard that.
Yeah, absolutely. Yeah, there's some fascinating studies that were done. And I'll just give you one of the most interesting is a study that was done in Baltimore by the U.S. Department of Agriculture. They took ragweed plants, ragweed pollen, that was growing in they planted ragweed seeds in the same soil in bins in the inner city of Baltimore, out in the country, and in a suburb in between. And the inner city plants, with this really polluted air, mostly automotive pollution, grew to be twice as big as the rural plants and produce 5 times as much pollen. And here's the thing about pollen. It's not just something that plants use to propagate themselves. Pollen contains enzymes that are damaging to your respiratory tract, that produce a state of oxidative stress and free radical damage if you inhale them in. So the pollen is not just the allergen, it creates the damage that makes you allergic to it. And air pollution increases the pollen, and it increases the allergenicity of the pollen, because the allergens in the pollen are defense proteins. So we're stressing ourselves and we're stressing the plants. And that's why this is a skyrocketing epidemic.
But you said we could actually change it. We could change the world. Where do we start?
Well, we start with the personal choices that we make. And Jonathan and I go into that in a good deal of detail. But these are choices that have to do with just what you use to clean what you bring into your home. There's this fascinating study in which the air in backyards, which actually goes out to the street, was studied, and the composition of that air was looked at, and whether or not you used a clothes dryer that had stuff added to increase the scent of the clothes.
Or like a softener, or even a soft dryer sheet.
Softeners and deodor and odorizers and perfumes and stuff. All of that stuff wound up in the street when people were using it in their dryers. So what you use in your home will affect the world as a whole. And what goes on in the world as a whole will affect what you're exposed to and what goes on in your home.
And our children for generations to come.
And what happens to your children. So how much you drive and what you drive and all of that winds up becoming important. And every little decision that you make is part of the whole. And then there's the impact of nutrition on those factors. Fast food increases allergic reactivity, increases inflammation. Standard American, typical modern Western diet increases inflammation, increases allergic reactivity. Foods that decrease inflammation and decrease allergic reactivity and that have been studied include fruits and vegetables, especially because of the flavonoid content of the fruits and vegetables. It includes omega-3 fatty acids from fish and fish oils. I mean, there are just tons of studies that have been done, some of them in the U.S. even. They're just not, I mean, nobody's paying attention to them. I mean, here's just a simple study, because we talked about pregnancy before. Study done in Denmark found that when mothers were supplemented with about 1,000 milligrams of omega-3s during the last trimester of pregnancy, there was an 86% reduction in the development of asthma in their children by the age of 20 years. Now, you can only do that study in Scandinavia, where they follow everybody from, the cradle to the grave, and where not too many people leave. You don't have a tremendous turnover of population. You have a stable population, you have great health records, and so you can track the effects of an intervention like that from the time the infant is in the womb until she or he reaches adulthood. And so there's a huge possibility for us to impact on the health of our families, ourselves, and in a variety of ways, the health of the planet.
Mm-hmm. And I think about this sometimes because we're in such a mess now. And it's going to take a few generations to dig out. And only will we dig out if we become conscious, which is the importance of the work that all of us are doing now, and summits like this and books like yours, to wake people up. Not just to wake them up. I mean, I think people are waking up, but you've got to have information, and you've got to keep absorbing, just almost submerging yourself in this information. Like, I'll listen to a lecture 3 or 4 times. I might, give it up for, like, not listen for a month or something, but come back to it. But every time I do, I hear something I didn't notice before. And all together, I'm just constantly building a foundation of knowledge and then building on that foundation. I think that's another responsibility that everybody has right now too, is to literally submerge yourself in wisdom, like hang out with the people that are telling the same, story and telling the truth and are trying to make a difference. There's a lot of Alexander organisms in our community today trying to wake us up and motivate us.
Right. There's some Alexander people out there.
Right. And because we need that kind of motivation, because we really, really are in trouble. But the other good side of it, and this is what I think, is looks pretty bad, but if we never knew what we know today, like the man was clueless 2 generations, like we're baby boomers, and our parents knew nothing compared to what we know today. So it's good that we've made all these mistakes because it's woken us up. And I think we can go forward with this new knowledge and create a civilization that people have never experienced before.
Right. We have to transform information into knowledge and make that knowledge, turn that knowledge into actions. And that's incumbent on all of us, because we're going to be lost without that.
Well, that is a perfect way to end. Great thought, great last-minute thought. So thank you so much for this interview. I know this was a lot of your time, and I hope at this point everybody's rushing out to buy the book. I can understand the subtitle really well now. It's not just the allergy solution. The subtitle is The Surprising Hidden Truth About Why You Are Sick and How to Get Well. And as I said from the very beginning, this book is way, way more than you can ever begin to tell from the simple title. So thank you so much, Dr. Galland, for writing it. And can you tell everybody how to follow your work? Like, I know you have a Facebook page and there's Twitter. And
Right. We have a Twitter and a Facebook page. My son Jonathan, he basically supervises and runs that. I'm spending most of my time treating patients, and we'll get you that information.
Thank you so much, Dr. Galland, for the work you do in the world and for this interview today. Thank you.
Okay. All right. Well, thank you, Donna. It's always great to speak with you, and I really enjoy it. And thank you for putting this summit together.